Diabetes is not a single entity or a single disorder. Rather, it is an umbrella term which encompasses various processes which ultimately lead to a raised blood sugar or hyperglycemia. So there are multiple types of diabetes, like your common ones are your type 2 diabetes, which is what we see usually in overweight or obese people, or people with let's say in the 40s 50s, who are responding well to medication. This is your type 2 diabetes. Type 1 diabetes is usually a more dramatic presentation. Usually you might see children who are very thin, who are losing weight, presenting to ICUs or to hospital emergencies with breathlessness, abdominal pain, vomiting, which is a medical emergency, which is known as diabetic ketoacidosis. So, children with type 1 diabetes usually have very little insulin production in their body, and they require insulin therapy throughout their life. Then there are more rare types of diabetes, like monogenic diabetes, where you have a defect in a single gene which can lead to diabetes, and this can have a multi-generational history. That is, many generations in the family will have diabetes occurring at a young age. Then there are some other forms of diabetes which are associated with pancreatic disorders, some which are associated with mitochondrial disorders, some drug induced, like let's say glucocorticoid or your oral steroid therapy or injectable steroid therapy for various disorders, etc. But when we speak about diabetes, most often we are talking about type 2 diabetes, which is the most common type of diabetes, and which is what we see, like when we talk about the number of diabetics increasing in the population, we generally refer to an explosion in the number of individuals with type 2 diabetes. Most prevalent form of diabetes, that is type 2 diabetes, it may have symptoms or it may not have symptoms. The common symptoms being an increase in thirst, increase in urine frequency, increase in urination at night, or a weight loss which is unintentional. These are the cardinal features of type 2 diabetes. It may not be present in all of the individuals, and it is you often said that diabetics, that is individuals with type 2 diabetes, will have raised blood sugar levels for many years before diagnosis. This is why screening for type 2 diabetes becomes very essential, especially in our population where the prevalence of diabetes is quite high. So it might be that you have raised blood sugar levels, but you don't have any symptoms or you don't feel anything because of it. But just because you don't have any symptoms, or just because you don't feel anything different despite raised blood sugar levels, does not mean that you will not face the consequences of raised blood sugar levels. So it is imperative that people with a strong family history, who are obese, women who have PCOS, or who have any of these symptoms, they get tested for diabetes. And even our uh, body for diabetes recommends that all individuals who are 35 or older be tested for diabetes. The tests that are required for the diagnosis of diabetes is your fasting blood glucose value, your post meal or post glucose challenge blood glucose value, that is 2 hours after you have been given glucose or a meal. And the third one is an HbA1c test, which will tell you about your blood glucose levels in the last 3 months. So fortunately for us in India, the tests are even available as a home-based test collection, and the cost of testing is quite low in our country. The reason why we treat blood sugar levels in the first place in diabetes is not just to alleviate symptoms, it is to prevent the long-term complications of diabetes. So the long-term complications, raised blood sugar levels will impact all your organ systems in the body. But the ones we are particularly concerned about is your eye in terms of your retinal health, your kidneys in terms of diabetic nephropathy, your cardiac profile, that is any issues with the heart, and there can be many issues with the foot as well in terms of peripheral neuropathy, that is an impairment in sensation, or peripheral arterial disease, where there is an impairment in the blood supply that goes to your legs. So when we look at diabetes, we want to get the blood sugar levels within a reasonable limit to prevent all of these complications. And the other thing that has to be kept in mind, particularly in type 2 diabetes, is that many of these patients will be overweight or obese, and many of them may also have hypertension. So we are not just looking at diabetes and its complications, we are also concerned about the complications arising from obesity and hypertension as well. Very important that the type of diabetes be known, especially because we have many young people as young as maybe 10, 12, 15 presenting with diabetes, which eventually turns out to be type 2 diabetes. So it is very important first to know which type of diabetes it is, because that is what your therapy is based on. And if we talk about the most common type of diabetes, that is type 2 diabetes, here diet and lifestyle play a very important role. So in terms of diet, again, an individualized therapy or an individualized approach to diet is very important, because even if we move from state to state or district to district in India, the food patterns or the food preferences of our population changes. So based on that, it's better to know what you're currently having and how it can be improved, with the general principles being to avoid processed food, to avoid trans fats, to have a healthy balanced meal with a lot of fiber, a lot of green leafy vegetables, and to have certain types of fruits as well, and to have a healthy amount of protein in it. This is about the diet. And all of this plan, it should be realistic. It should involve the patient in the decision making process as well. And coming to the exercise, should involve cardio, that is your walking, your jogging, your cycling, etc. It should include a bit of strength training, whether it is at home or in the gym or elsewhere. And it should also involve some sort of balance exercises. And there are very easily available exercises which help you with all the above. And coming to the medication part of this, it is imperative that you go to someone who's qualified to give you these medications. And with these medications, it's very important to know when to take them, how to take them, what are the precautions when you take them, and what can we expect when we take these medications. And along with this, there should be a very clear idea of what we're trying to achieve when we start these medications or when we start these diet and lifestyle measures. One, and how we are going to follow up this issue at the first visit itself. There are a lot of misconceptions about insulin therapy. So, if we are talking about type 1 diabetes, which again is more often seen in younger children, but it can manifest in older individuals as well in the form of latent autoimmune diabetes in adults. So these individuals will not be able to manage their blood sugar levels with anything other than insulin. So for them, insulin is non-negotiable, and usually they have to take a long-acting insulin along with 2 to 3 doses of pre-meal insulins as well. And in type 2 diabetes, where oral medications may also suffice, in this, there are certain circumstances where insulin will be required, like people who have been taken a lot of oral medications for many years, but now it's not getting controlled on those medications. Then people who have been diagnosed with diabetes and have very high blood sugar levels. So for them, initiating treatment with insulin and later shifting to oral medication might be more beneficial. Along with this, people who have infections, who are admitted in ICUs, who have renal dysfunction or some liver issues, etc., these people may also require insulin therapy. First, we should be able to classify what etiology of diabetes this is likely to be, and based on that, involving the patient and their spouses or guardians into the decision making process, we should create a diet and exercise plan that is sustainable and that is acceptable to the patient as well. Along with that, list of what medications the patient is supposed to take, when he or she is supposed to take these medications, and what precautions are to be taken, that has to be understood and explained well to the patient. And if the patient requires insulin, a lot of attention and a lot of persistence and follow up and a very kind, empathetic approach needs to be administered by the caregivers or by the doctors, because most often there are some problems either with insulin, how they're taking it, when they're taking it, where they're taking it, how they're storing it. So this is something that requires constant support and constant some level of constant follow-up. And once we take care of the sugar part of it, we have to move beyond just the raised blood sugar aspect of diabetes, and we have to formulate a plan as to how we are going to screen for the complications of diabetes, and two, what are the other coexisting disorders other than diabetes that this individual may have. So any individual who's more than 40 years old and has diabetes should be on lipid lowering medication, as well as diabetes itself will lead to a higher risk of cardiovascular issues or heart issues in the future. Monitoring of blood glucose level is all about context. It should be individualized. So if we are talking about patients with type 2 diabetes who are on medications and doing well in terms of their sugar control, they should get their fasting and post meal sugars checked at least once a month, and they should get their HbA1c, which will tell you about the long term sugar control, at least once every 3 to 4 months. Lipid profile should be done at least once or twice a year. Along with that, the retinal examination, that is checking of your retinal layer of the eye, that should be done at least once a year if there is no abnormality. And in terms of kidney complications, a urine report, that is a urine ACR report, and a serum creatinine report, that should be done at least once a year. And in terms of cardiac risk, based on the patient profile, which test to administer to look at the cardiac function should be decided, and how often do we repeat it, that should also be decided based on the risk stratification.